Platelets are the smallest cell in the bloodstream. They are about 4.5% of all the cells in the human body. They're essential in hemostasis, that is, in stopping bleeding. We know that because people who have very low platelet counts have a tendency to bleed, and also people who have inherited dysfunction of platelets also have a tendency to bleed, and that bleeding can be from very mild to very severe. What we learn from that is sort of as a global picture is that the presence of adequate numbers of normally functioning platelets is essential for normal blood clotting. In the old days, back in the 1960s and whenever platelets became an actual separate transfusion item, all products were stored either frozen or at refrigerator temperatures. And so people used cold stored platelets or refrigerator stored platelets for a decade or more very happily. And then in 1969, Scott Murphy and his colleagues published a landmark paper in the New England Journal of Medicine. In that paper, they showed by comparing platelets that had been stored in the refrigerator to platelets that had been stored at room temperature, that the room temperature stored platelets were present in the blood circulation much longer than the cold stored platelets. And so based on that very important finding that there was very much a superior recovery and circulation time of room temperature stored platelets, it became the standard of care in the United States and throughout the world. At that time, and still today, a large portion of platelets are actually transfused, not so much to affect hemostasis in the moment, but rather to support a higher platelet count than the patient normally has to prevent bleeding from happening. So having a longer circulation time and a higher recovery was a reasonable goal. I think an important aspect of cold stored platelets as an initiative in transfusion medicine today in 2019 is that among all of the initiatives in transfusion medicine that are ongoing, pathogen inactivation as an example, certainly utilization, optimization, and other major things that are going on worldwide, the only one I can think of involving standard blood products that would actually improve the efficacy of the product with a simple measure is the potential adoption of cold stored platelets. As it turns out, people studied this in detail. One particular important paper was done by Dick Astor, Tom Konicki, and their group at what is now the Blood Center of Wisconsin, published in 1973 when they compared the functionality of platelets that were stored at room temperature versus those were stored at refrigerator temperature, and they showed demonstrable superiority in terms of affecting hemostasis of the platelets that were stored at refrigerator temperature. That paper was an extremely well done paper by an extremely capable group. The transfusion community didn't really absorb that finding in the sense of adopting cold stored platelets as a standard of care, probably because the goal of having a longer circulating time and a better recovery was a more important goal for platelet transfusion therapy at that time. There's a sudden resurgence of interest in the use of the cold stored platelets that in these early studies had been shown to be, as I said, demonstrably more effective. So there are clinical trials now that are ongoing to demonstrate that in a wider patient population. The other sort of impetus for that among a lot of places is that cold storage of platelets obviates the problem of room temperature storage that permits the growth of a lot of bacteria that would not otherwise thrive in the cold. And since bacterial contamination of platelets is by far the most common infectious disease problem associated with platelet units today, the ability to put them in the cold, like red blood cells, would vastly reduce that problem of the growth of bacteria in platelet units during storage. So for purposes both civilian and also in the military, where the storage of platelets is much more complicated than it is in civilian hospitals, and where platelets being conveyed out to remote areas of the battlefield, etc., having a cold stored platelet that has a longer shelf life, better hemostatic effect, and much less risk of bacterial complications is a very desirable proposition. Currently, the FDA allows cold storage or use of cold stored platelets. There are some limitations. One is that institutions have to apply for a variance to FDA to use cold stored platelets. And secondly, the use of the platelets is limited to 3 days of storage, which is a very short storage time for platelets because the supply is not adequate to easily accommodate a very short shelf life. So investigators in a number of places now are very interested in a couple of issues. One, can they demonstrate the functionality or the improved functionality of cold stored platelets for a longer storage period, say 5 days, 7 days, or even out to 20 days, such that in the long term, the regulatory bodies like the FDA could be convinced that cold stored platelets could be a licensable product for an extended storage. Now, the challenge with respect to FDA is the same as with any drug or any other biological product. FDA has a fairly long process, a gauntlet that must be traversed in order to get wide licensure or a change in FDA recommendations or guidelines with the use of the product. So I think that right now, investigators who are exploring cold stored platelets as an alternative to room temperature stored platelets have yet to probably come to terms precisely with the FDA in terms of what it will be required in order to change FDA thinking on the recommended storage of platelets. But the fact that the FDA already allows, with a variance in place, the use of cold stored platelets, and has for a long time, I think is certainly an important impetus for continuing the clinical exploration of this product. It's not entirely clear why storing platelets at refrigerator temperature versus at room temperature should have such an important functional impact on their efficacy once they're transfused. People speculate that, among many things, it's certainly true that platelets are living cells. They have mitochondria. They use glucose in the glycolytic pathway as well. And it is certainly true that platelets during storage generate lactate. Lactate lowers the pH, and the lower the pH, the poorer the function of platelets overall. So one thought is that by storing platelets in the cold, like red blood cells, you slow down glycolytic metabolism for one thing, and therefore produce less lactate and reduce the effect of pH on the function of platelets. But I think there's a lot more that needs to be learned about why cold stored platelets function better both in vivo and in vitro than room temperature stored platelets.